So the story continues. The surgical resident finishes what he's doing, all done, and he leaves the room. And I start to finish up going to work on cleaning up the blood and the tubes and straightening the bed up and getting him prepared for the morgue. And then all of a sudden, the clinical nurse specialist for our emergency department comes in. Now, in our department, we have psychiatric clinical nurse specialists on almost every day. And their goal is to help support the patients with psychiatric issues, as well as to be there for the staff and for families when there are difficult events happening, like traumatic deaths. She comes in and she tells me that the family is here and they would like to see the body before it goes to the morgue. And I looked at her and I said, "Are you sure?" And she said, "Yes." And I said, "Well, who's here?" And she said, "He has a wife." And I said, "Oh." And she said, "And he has 2 small children, but they're 5 and 3. So we're not going to obviously bring them back, but the wife would like to see him before he goes to the morgue." And I took one look at the patient and I said, "I can't believe she would want to see this. I mean, I can make him look better, but I don't really think that she needs to see him like this. He's going to look so much better at the funeral home where they can do a much better job of making him look like he normally would for her comfort's sake." And the CNS and I talked about it back and forth, and she said she would go back out to the wife and really prepare her and check again. And sure enough, she comes back in and she said, "No, the wife is insisting. She wants to see him." And though I was adamant that it shouldn't happen, I totally understand that 99% of the patients I deal with, when their family members come in and they have died suddenly, whether it be from a heart attack or a trauma, they want to see them. They know they just passed away and they want to still be there and feel like they're with them before they move on to the funeral home. And so, and we found when we've interviewed them after the fact, these family members, they are so grateful that they actually saw them in the emergency room. And that gave them some closure and a chance to say goodbye before they had to go see them in the funeral home. So I said, "Okay, I get it. I understand, and I will try and do my best to make him look wonderful." But now I'm a little upset. He's a father. He's a husband. I didn't know any of this before. That's how we deal with these things. He's an unknown trauma male, and though I know it's sad that he died traumatically, I know nothing about his life, and so I can compartmentalize. That's kind of how we deal. And unfortunately, now I know too much. I know he has a wife. I know he has children. So trying to push that aside, I say, okay, well, I'm going to make it the best possible thing for his wife. I'm going to make him look good. So I go to town. I get one of my friends who's working, and she comes in to help me, and we're cleaning him up. And I'm washing the dried blood off of his hand and stuff, and I'm trying to get his wedding ring and that hand all cleaned up because I'm going to leave it exposed outside of the sheet so that in case she wants to grab his hand and hold it and talk to him or pray over him, she can. But I'm washing him up and I hear crunch, 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 and I know all the bones in his hand is probably broken from impact. But I try to make it look as normal as possible. And he's got the ET tube in, the endotracheal tube, and we have to leave these things in case there's an investigation. So I cut it and I close his mouth so she can't see it. And I cut all his IV lines and I tie them up. So they're still in him, and all the lines and tubes and wires and things that we put in him are there. They're just all hidden under the sheets and the blankets. And I wash him up and I prop him up on a pillow and I'm laying him out on the stretcher and I dim the light so it looks like he's just resting. And I stand at the end of the room and I look at him and I say, wow, considering what a disaster this entire room was, the floor's been mopped, there's no signs of blood anywhere, he looks really good and I'm proud of myself. And I say to the nurse, thanks so much, he looks awesome. I feel so much better now that she can view him like this. He's gonna look good for her. And so we're excited. And so I go tell the CNS, go ahead, bring the wife in. I'm ready for her. And so she goes to get her.